Welcome everybody to our Estrela Star Past webinar series. And tonight our guest is Julia Blanchette, Dr. Julia Blanchette, who I actually have had the wonderful, I've had the privilege of knowing Julia for actually, I don't even know how many years now, Julia. I was trying to add it up, but it's been a
Been
handful
a
of
long
years
time.
because, yeah. And so I'm super excited to have her here with us this evening. My name is Kristina Dooley, and I am the founder of Estrela Consulting, which is a full service college planning firm located in Hudson, Ohio, with work happening with students all over the world. So we're excited to host this Star Path series. And if you are new to our Star Path series, I will put a plug in that if you go to the Estrela Consulting YouTube channel, you'll actually be able to see past interviews as part of our Star Path series with lots of interesting people. Julia and I were just talking about some of our past guests before we jumped on live. And so please take some time to go on there. And if you are a counselor, a school counselor, an independent counselor working with students, or are a parent and thinking that maybe your child is looking at different options for careers, those are really helpful. All of our Star Path webinars are 30 minutes in length, and we are very good at keeping that prompt time commitment because we know people are busy. So for those of you joining us live, welcome. If you're watching the recording later, welcome to you as well. And without further ado, I want to introduce Julia. And like I said, we go back a little bit of time. I actually was thinking, I believe I first met Julia when you were finishing your undergraduate studies at Case Western Reserve University. And that was a while ago, not super long ago, but it was a while ago. And so what I thought we would do tonight is have you maybe share a little bit about your background, Julia, just to get us started in terms of where you started with your nursing schooling. We'll get into details about the why in a few minutes, but where you started and where you are now and what you're doing, because I think you're doing some really cool things. So I'll just let you go ahead and introduce yourself.
Great. Thank you so much for having me. I'm excited to be here. So I went to Case Western Reserve University to Francis Payne Bolton School of Nursing for my BSN degree. And so that's a 4-year degree in nursing, normal undergraduate degree, bachelor's degree. And then from there, I went straight through to do a BSN to PhD program in nursing, also at the Francis Payne Bolton School of Nursing. And then I did a 1-year postdoc training program at the University of Utah College of Nursing. And now I'm at University Hospitals Cleveland Medical Center, and Case Western. Again, I'm back at Case Western, but I'm actually at the School of Medicine as an assistant professor. And I do have a part clinical and part research job. So I get kind of the best of both worlds, and I get to teach med students how to do research.
Well, I love that you teach also, because I think I'm going to ask you some questions later about the right kinds of students to pursue pathways like this. So I think it's important. But one thing I want to just point out, I'm pretty sure you're not from Cleveland area originally, right? So
I'm
tell us
not.
a little bit about your college search, because the people watching this are either parents, students, school counselors, et cetera, and working with teenagers trying to navigate this process. So tell us a little bit about your college search and how you ended up at Case.
Yeah, that's a great question. So, I'm from Connecticut, so 500 miles away from Cleveland, Ohio, and as you know, there's a ton of awesome schools in New England, and I would have loved to stay in New England. I applied to a lot of schools in Boston, New York City, Washington, D.C., Philly, and I applied to one school outside of the Northeast. It was Case Western. Um, so Case was it seemed a little random location-wise, but I applied to Case because an admissions counselor from Case actually came to my high school in Connecticut and talked about the nursing program. And I knew a girl who was a year older than me who got into Case's nursing program. She ended up going to UPenn, but I thought, wow, she almost went to Case for nursing and she's at UPenn. Must be a good program. And so I went to the session at my high school. I thought it sounded like a great school. It was at the time we had the Common App and it was free to apply on the Common App. So that was definitely a plus.
Mm-hmm.
So I applied early action. It was one of the first schools I got into. And I thought, wow, I have a great option. And I felt so relieved. I think I applied to like 25 schools total because nursing programs are not known to be easy to get into. Some of the schools, I got into the school, but not the nursing program, but Case, I got into the nursing program. And so that was really important. And yeah, it was just it ended up being a great option for me in the end. So
That's
that's
awesome.
why
And you stayed. We're glad to
I
have you.
stayed.
Yeah, for those who are watching who aren't familiar with the geography of Ohio, I mentioned that I'm in Hudson, Ohio, so Cleveland is very close, and I grew up near Cleveland. So I'm a big fan of you, Juliet. I'm glad that you stayed and are part of our network here. So thinking back, I know it's been a few years, but thinking back to your high school experience and thinking about the decision to actually pursue nursing as a major, did you know much about things like direct entry nursing programs? How did you learn about that? And did you already, were you set on nursing? Was that a thing? And how did that come to be? Why?
That's a really good question. So I was not 100% set on nursing. I was 100% set on the healthcare field though. So I knew either I wanted to be pre-med, nursing. I was really interested in actually like public health research. So I always had a little bit of a research interest, but I didn't really know that what I'm doing now was an option, right? So I had a couple of family friends that were nurse practitioners, and one family friend that she's an attorney and a nurse, and she worked at Yale New Haven Hospital, and I was very inspired by her career. And so I was also inspired by my own diabetes educator nurse practitioner. So I knew a lot of nurses that that really liked their careers, and I knew I could help people with type 1 diabetes. That was important to me. And so I honestly picked nursing because I thought it was a pretty solid option to make sure that I would have a career. And my parents got divorced when I was in high school, so to me it was important to make sure that I could fall back on something, that I'd have a job. Like that kind of was important. So yeah, so that's how nursing came about. I really didn't have any experience in it. I just knew it would be of interest and knew it was a good career. So that's kind of how that happened. And then with the direct entry, when I started applying to schools, when I read into the nursing programs, I learned that some of them were direct entry where you applied right to the nursing program, and others you had to take the prerequisites before you could then apply to be in the nursing program. So a school that I was already into the nursing program was really appealing to me as well, to make sure that I was all in, ready to go to dive right into nursing. So
Did you ever have any fears that you would get into that kind of into a direct entry program and then change your mind? I
oh
ask
yeah,
that because that is a concern that sometimes students say, you know what, I'm really, the direct entry is super appealing, but what if I decide after year one that it's not for me? And if so, because you're on the teaching side now and you kind of see some of the things that happen, what would be options for students? Like, is there anything that you
yeah.
recommend?
That's such a good question. So I think I was just more scared about not having a career. So to me, I was more worried about not having the option to be a nurse. Once I got there and I dove right in, I was like, whoa, what if this isn't for me? This is a lot. And then I just think it really helps to know nurses and know that I knew nurses that did a lot of different types of things. So I knew, okay, I'm doing clinicals, I'm doing this bedside nursing on a medical surgical unit, but I want to be a diabetes educator, which is very different, and I will get through this. Like I kind of had an end goal. So that
Mm-hmm.
helped me a lot. So I actually have a couple of friends that ended up deciding nursing wasn't for them. One of them actually ended up switching to a nutrition major, and she's a registered dietitian now. And that was a great switch for her. She really liked her nutrition course, her anatomy course, didn't love the clinical courses. And that was fine, and it worked out fine. And one girl in my nursing class switched to biomedical engineering. She took a statistics course and she took a research course, and she was like, I'm way more into this than nursing. And she kind of went a different direction. The great news is you have some of the prereqs done if you do that.
Mm-hmm.
So it's not like you can't switch majors. You can. It's possible. So and don't
That's
be
good.
discouraged.
Yeah, that's good advice, I think, for students that are concerned about that because, again, the direct entry programs are attractive because it's there. I'm curious, you mentioned, and I should, in full disclosure, Julia and I know each other, and some of you have heard me say this on past webinars too. My daughter has type 1 diabetes, and so that's how I actually met Julia. Um, but I know a lot of students are inspired to go into healthcare because of their own journeys of, and what they've seen. And my son right now says maybe an orthodontist. I'm like, yes, that's what you should do. We'll get it'll come back to us somehow. But I think about students like that who are thinking, you know what, I know what I want to do because of my own personal experiences. Are Do you feel like it's what you expected because you were seeing it from the patient side, as when you were thinking about being a nurse in this space? What is not what you expected, I guess?
So I think nursing, Okay, so I had no idea what a bedside nurse actually did. And so it involves a lot of hands-on skills, a lot of critical thinking, a lot of quick on your feet thinking, a lot of teamwork. Like I had no exposure to that side of nursing, which most people think of as traditional nursing, right?
Hmm.
I really had more exposure to here's a diabetes educator, here's an outpatient nurse practitioner, an outpatient endocrinologist. Like those were my personal experiences, so I think I expected it to be a little bit less chaotic, for lack of a better way to say it, than my
Hmm.
training was. So that really surprised me. But I think, everyone at Case Western was really supportive of my interests in going into diabetes education or research. So I think that really helped me. Even though it was different, I knew that there was more I could do with it than what I was seeing in my training. So that helped a lot.
Awesome. Well, and I like your suggestion earlier about, that you you knew people or you talked to people or you kind of, and I think that exposure early on is really important, I think, because a lot of students know about careers kind of in silos. Like maybe they know like one person who's done, or they've seen it on TV, they've seen
Yeah.
something and that's their whole perception of a particular kind of career, which I would say like in nursing, you just mentioned several different like kind of areas. There's so many different areas within the nursing profession that students with different, I guess, different passions or different, things that they'd like to pursue in the healthcare field could do that through nursing in specialty areas.
Definitely.
Before I move on, I just want to just add for anybody who's on the webinar live, if you've got questions, please throw them into the Q&A and we will definitely get to them once we chat for just a bit more. And we already have a great question there, which I am going to throw out to you right now, Julia, because it's a really good one and one that we get all the time. When students are looking at nursing programs, and I don't know if this is something that came into your search, do you think they should be looking at the pass rates for the NCLEX? Is that something that they should be a determinant about, oh, this school is less than, it's 85% versus 92%, what, do you think that that's a big reason for someone to discount a school?
I think as long as it has like a credible NCLEX pass rate, then you're fine. The reality is some students aren't good test takers. And like
Yeah.
I went to a top nursing school with very smart kids who did really well. Like you had to do really well. I mean, I don't know anymore, but at the time on the SATs or the ACT to get into Case. I don't know if they still require those tests or not.
That's option.
Yeah, test optional, but some people aren't good test takers. I knew people in my program that didn't pass the first try, but they got so much support from Case Western. Like they got remediation support and additional resources like from our program to then help them pass. So I think part of it is like looking at that saying like, people have problems sometimes taking tests and it's okay. And you're not gonna like 100% like I wouldn't base it on that. I would say too, like part of the reason I picked Case Western, in addition to it being direct entry, and in addition to them offering me a decent scholarship package, was that I really liked that there was a lot of research. Like that was important to
Mm-hmm.
me. You don't find that at a lot of nursing schools, and I also really just liked the some of the other core coursework that we had to do for the bachelor's degree requirement at Case. Like I liked some of the general education requirements. We had these really cool like seminars that you took with other people across the university. And so to me, I think some of it too is like you want to look at the whole picture and not just at the
Mm-hmm.
NCLEX pass rate.
Yeah, I think that's really good advice. I also like your comment about the research piece of it and that being something kind of distinctive for some programs, that some of them are more research based. What kinds of research did you get to do as a student?
Okay, so as an undergrad student, I actually spent a summer in a cystic fibrosis lab where we looked at aquaporin gene expression in mice. And so it was like very bench science, which I hadn't been exposed to. And so, I mean, I was using, I mean, it was like under the microscope type lab experience. And what was really cool though is I got to see the results and actually see how it translated to impact patients' quality of life. And so that was really appealing to
Mm.
me. In the end, I obviously didn't end up doing bench science. I do very community engaged and psychosocial type research right now, so it's not under the microscope, but it was a really cool experience, and it's what introduced me to research, and that was all because of Case Western's nursing program. And then I also got to spend a semester in Alaska working with a public health department to do a quality improvement capstone project. And so we worked on increasing immunization awareness and immunization rates, and like that was so cool. Not all programs would have sent me to Alaska to go do a project for the semester. So that was also really awesome.
I will just let me put in a plug. If anyone from Case Western is watching this, you need to bring Julia in if you don't already to help with your recruitment because
I'm on no, Kristina, I'm on one of the pamphlets. I'm actually on one of the pamphlets. I don't know if I still am, but I was a few years ago. So
I mean, you can tell that it's exciting. I really like what you said about the bench science piece because bench research, because I think some students, when they look at programs, they're turned off by certain things that they may be required or expected to do because it doesn't fall under like, that's my ideal job or my ideal type of thing. But I think the exposure to that, like you mentioned, I think is probably incredibly helpful in the end.
yeah.
So
Yeah,
that's great. So you mentioned the kind of research you do now. For those of us out here who don't really know what that means, you talked about working, you said psychosocial. Tell us more, like, what does that entail? What do you do?
Yeah, so I have a PhD in nursing science. So that means I have a research doctorate in nursing. So part of that was really understanding nursing theory, which probably doesn't excite anyone on this call besides me, and understanding clinical research and how to improve lives of patients, right? That's what nurses do. So it's really taking that to the research level to continue knowledge generation in nursing. And so what I do right now is I look at different barriers to diabetes self-management and how to address those barriers through interventions developed by the community.
That's a great summary.
The easiest way to explain it.
Yeah, no, that's a great summary, and helpful for those people who aren't, because I think what a lot of us people who are working with teenagers going through the process, they think in terms of the initial stages of a nursing degree, the BS, and thinking like, okay, this is what they're going to do, and they're going to go into a hospital setting, and that's what you do with the nursing degree. So it's good to hear a different kind of pathway in terms of what the opportunities are and that specialization kind of area. So there's another question, as we're talking about, high school students thinking about looking at nursing programs. Are there certain kinds of things, and you mentioned like some of these opportunities you got to do as an undergrad. I imagine right now you get the opportunity to bring in students to work with you, current undergraduate students, maybe even to work with you on different things. Thinking of high school students, are there certain things that either you think would have been really helpful for you to do as a high school student to either demonstrate your interest in nursing or to help you even get more exposed to it? Any kind of like activities? Let's say you were on the admission review committee for the program at Case.
Yeah.
What would you be hoping they would have?
So I think what they really liked about my application is I had a lot of volunteer experience with the diabetes community, even in high school. I had a lot of childcare experience. I had camp counselor experience. And I think one thing that I was missing that helped some of my other friends get into nursing school is I could have volunteered at a hospital, but I chose to volunteer for diabetes organizations instead. Mm-hmm. So that was what I spent my free time doing. But I think there's tons of volunteer opportunities at hospitals for high school students. And I think that's really great. And I think I have a couple of friends too that were able to actually get into some labs in high school. And I think that would have been favorably looked at as well for nursing too. So,
and do you think students can just do some cold call outreach to lab? Like, what do you think they could be doing? Are there, obviously where we are, we were just talking about, there are summer programs through like UH and Cleveland Clinic. In other parts of the country, they may not have access necessarily to big programs like that. But if someone was interested in just getting in and getting some exposure, I know there's sometimes issues with even the age of the student, that kind of thing, being able to go in. But do you just say, if you're interested, reach out and see what lands?
I mean, so yes, I think a great thing to do if you have connections someone's parent knows somebody that
Yeah.
works in the lab, even use that. But I have no problem with cold calling or reaching out randomly. That is what I did I did a lot of that to get to where I am. So I have no shame. So I always say, if you don't have a connection or you don't have a way in, don't be afraid to reach out, because you never know.
Mm-hmm.
The worst thing that's going to happen is they say no. So
Yep. Yeah. And I think that's good advice in every major that or academic area that a student would be looking for. I tell students often, utilize the people the adults in their lives who have connections with different people. And I mean, just even going on LinkedIn and searching through the people that
yeah,
their parents are connected to, there's likely somebody in a career that they might be interested in. And I think it's a good exercise for them to reach out. And even if it's not necessarily lab exposure or getting into a clinical setting of some sort, even conversations help too, because I think that sometimes, again, 16, 17-year-olds don't really understand or grasp the day-to-day job, that someone might be doing in healthcare. I think is one that's often misunderstood. So what about, there's a question like with activities, what about if a student wasn't like an EMT, like a volunteer or a
oh,
certified EMT? Yeah,
that's
great, right?
great. That would look
Okay.
fantastic. And that's really good for the student, because they're getting exposure already to some of the stuff they're going to learn earlier on in nursing school. So it's a win-win.
That's awesome. Good. That's good advice for the students. We have another question. Are the acceptance rates, and I don't know if you'll know this or not, but are acceptance rates higher for applicants in a post-baccalaureate program, or are such persons valued as candidates due to their relative maturity? So I think the
Yeah.
question is,
Is it
go
about
ahead.
nursing
Yeah.
post-bacs?
Mm-hmm, mm-hmm.
So I think it's interesting. So I think, I don't know. I actually don't know the answer. So Case
Yeah, that's
Western,
okay.
the one I'm familiar with is the one that Case Western has, and they have it's a direct entry master's of nursing program,
Hmm.
post bachelor's degree, and it's not necessarily easier to get into, but I do think the people that apply are more decided, more mature, more set on going into nursing. When you apply to those programs that are direct entry post bachelor's degree, no matter if it's the MN or there's also the accelerated bachelor's and
Mm-hmm.
nursing as well, you have to be really committed to what you're getting yourself into, because
Yeah.
it's like the 4-year program I did, but like speed on speed. Like it's you do a lot in 2 years. So I think you really have to be committed, and that does take maturity, I think. So
Sure.
so
So
sorry, I don't
here's
have
a
an answer
question.
about the acceptance rate,
No,
but
that's okay. That's okay. When we
yeah.
get you into the working of the admission office, then we'll, yeah, no,
Yeah.
but
There.
that's good advice. So thinking again about preparation for students thinking about going into nursing, what about in your experience, have you seen either in your teaching and students coming up, and their preparation in terms of like math and science in high school? We get that question all the time. Is should these students be, for example, do I have to get up to calc? Do I have to take physics? What if I want to take AP Psych instead?
This is my
There's things
favorite
like that.
question. This is
Okay,
my
so what?
favorite question, actually, because
Okay.
let me tell you, I have a PhD in science and I've never taken calculus, because my senior year of high school, I took AP stats, because I looked into what was important in nursing. Math is not my strength. Of course, I have a ton of statistics training, very advanced
Sure.
statistics training now, PhD level, right? But yeah, in high school, I was very scared of calculus, and I thought, wait, for nursing, statistics is going to benefit me anyways. So I took AP stats. I never ended up taking calc. I took pre-calc the year before. Um, and then I ended up taking AP Psych. I ended up taking AP Bio my senior year. My school did it a little differently, because you take all of the science, or at the time you would take all of the sciences. So you take bio your freshman year, chem your sophomore year, and physics your junior year, and then your senior year you got to pick if you wanted to do an AP one or if you wanted to do
Mm-hmm.
some other type of science elective. So I picked bio because it seemed the least scary to me of the three. So yeah, and I think psych helped me a lot as well. And then I ended up getting some transfer credits from those AP courses I took,
APs.
because they were related to nursing, and because I picked the ones that I was interested in and that I did well in. So
And I think one of the, I don't know if it's a myth, but one of the things I hear often from students is, in terms of, for example, taking AP stats in high school, is that why should I take that if I will probably have to take that at the college level anyway if I'm in this program? Do you see that? I mean, is it still valuable to take that as a high school student?
Yeah, so I didn't have to take it in college.
Good.
But I had to take basically the same thing again my first year of my PhD. So if you can imagine, I had to take intro to stats again because they wanted to make sure, especially since I was doing my bachelor's to PhD, I didn't have the master's. Like it was
Yeah.
part of like the bachelor's to PhD curriculum. So my advice is if you need to take it again and it's going to be relevant to your career, it's not a bad thing and it'll be easier for you.
Hmm.
So
Yeah.
it's not bad to refresh on it and it'll be easier to do well in the course.
And it doesn't hurt as bad the second time, right?
Yeah, no, it really doesn't. I mean, I was like, wow, what throwback, but yeah.
Well, we're in our last few minutes, and so the couple questions that I'd like to add, just kind of more reflective questions for you, is: are there any things that you feel like are big myths about nursing programs that you would like to bust? Like for anyone right now to say, listen, you may be hearing this, and it's probably not true. Anything like that?
So I think everyone tells you that like the year that you take med surge and all the clinicals is going to be your worst year ever.
Mm.
But I really don't think it's that bad, especially if you have a good support system with your other fellow students and you get through it. That's the thing. If you really want to do it, you get through it. And my other advice is I have plenty of friends and plenty of mentees who may not have passed a course here or there. And that doesn't mean you fail out of nursing school. It's okay. And you can
Mm.
remediate courses. Sometimes it sets you back a little bit, but if you really want to do it, you can get through it. So
That's good. That's good to know. Good advice
yeah.
to know. I think, I think with students, as there is a fear of failure in every way for a lot of
Yeah.
students, I think, and that is, it keeps students sometimes from pursuing things that
Mhm.
they perceive as potentially a big challenge, and it feels like a big daunting thing when you're looking at colleges. You don't want to have to not be successful because you're choosing your academic area, versus high school, you take classes that you don't necessarily get to choose. They're kind of prescribed for you, so that's good to know that there's a little bit of flexibility there, that they are able to do that. And then my last question for you is: what's been your proudest moment as a nurse?
Oh my goodness. So I think my proudest moment as a nurse is so when I was doing my BSN, my junior year, I was able to take part, and this is going to sound really like, sorry if this is triggering for anyone, but I was able to take part in a code during my critical care course. And I actually helped bring someone's heart back from my
Wow.
chest compressions. And that was like, to me, that was like the most like real moment, I think. I mean, because like I don't work in critical care now, so I'm certainly not running codes now. And so I think
Mhm.
as a student, that was like really cool, and really,
Wow,
really meaningful.
that's really powerful.
Yeah.
Wow. Any final advice or words of wisdom for students? And there may be some students that are even right now trying to make their final decisions for college next year. We have some families that are senior parents, or students right now. Or any advice for those students in general that are thinking about this? Words of wisdom.
I think don't be afraid to explore what you're interested in. And I just think don't be afraid to put yourself out there. Like I think making a decision to what you want to do with your career can be a lot, but just be you and don't be afraid to reach out to others. I think that always helps. So
Thank you. I really appreciate you taking the time to share your own personal experience, but also some good tips with the people that are watching. And again, I think that the nursing is one of those areas that a lot of people think it's pretty cut and dry, but it's really not. I mean, there's lots of opportunities. There's lots of different kind of spikes off of, this typical kind of major, but it's not. There's a lot of things. So it sounds like from your advice is: get some experience, get talk to people that are doing this, figure out maybe even, is there a passion area that you have? Like I feel like you we talk about kids, a lot of times people say that students have to be well-rounded in what they do, but I think what your pathway showed actually in terms of going from your own personal experience with diabetes and your involvement in things that
Mhm.
showed, hey, I actually really do, this is actually really a big area of importance for me, probably translated really well in your applications. And as people who look at, hundreds of college application essays over time, it's good when we see things that are kind of consistent and show and shape who the student is. And I could see that from an admission standpoint, they probably looked at you and said, yes, the student knows exactly what they're really thinking about. So I appreciated that perspective, but I think it's okay to your point that if they go in and they try and it's not for them, it is not the end of the world.
No,
So
it's
there's
not.
there's other things that they can do. So Julia, thank you so much for spending the time with us tonight. Thanks for everybody for watching. And thank you for being part of our Star Path series. We really appreciate all your words of wisdom, and have a great night, everybody else. Thank you.
Thanks for having me.